Hello everybody, welcome. My name is Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT. I thought what we would do today is a video walking you through some visualizations and exercises that I often give my patients with chronic pain. And this is perfect timing for me because I hurt my neck last week, so let's heal together, shall we? So this is going to be exercises for chronic neck pain. So the first thing that we're going to do is put on our vagus nerve stimulation. And why, you may ask, are we going to do that? That is an excellent question. I encourage my patients to use vagus nerve stimulation for many reasons. When it comes to chronic pain, the first reason why vagus nerve stimulation is helpful is that pain is an experience that is produced by the brain based on how threatening it feels the information is coming from that area of pain. So the more that we can activate that parasympathetic nervous system again through the vagus nerve stimulation, the less threatening that information is and the less the pain experience will be. The second reason is that when we're talking about spinal pain, and in fact many other injuries as well, but we can get to that in another video, the main thing that we want to start with is strengthening the multifidus muscle. The multifidus is a small muscle. I'm going to show you a picture of it a little later in the video. It is a small muscle that lines up and down either side of the spine. And that muscle, in somebody who has never had any pain, the multifidi is always stabilizing with every movement that that person does. In somebody who has had pain, even if the pain is not currently present, the multifidi have stopped doing that. Now, the multifidi, being a stabilizing postural muscle, will be inhibited when our nervous system is in a fight or flight state. This is because if you imagine you're being attacked by a lion, what muscles do you need? Do you need your little postural stabilizers? No, right? So the body will actually turn off muscles like the multifidi and divert resources towards our big power muscles to either fight or run away. So by, again, activating the parasympathetic nervous system, you're going to get better recruitment of that multifidi muscle. And I see this time and again with my patients. In addition, anytime we have chronic pain, we are going to be working heavily with a concept called neuroplasticity. So the ability of the brain to make changes in the patterning of muscle movement, the neurons that have been wired together for a long time because of the chronic pain. We want to make shifts in those. And that requires neuroplasticity, which is the concept that the brain is plastic and that we can make those changes. Vagus nerve stimulation enhances neuroplasticity. The final reason why it's helpful with chronic pain is that anytime we stimulate the vagus nerve through the vagus nerve's interaction with the HPA axis, stimulating the vagus nerve reduces the release of inflammatory cytokines. So there's an overall drop in systemic inflammation when we're stimulating the vagus nerve. So that is always helpful, especially if there's chronic inflammatory process going on along with your pain. So I've got my vagus nerve stimulation on. I can already feel my nervous system coming down, which feels wonderful. And now I'm going to talk you through the first steps here that I would use with my patients. So I've printed an image here. This is from Wikipedia. Okay. So this is our back, mainly the upper part of the back here, the neck. So I'm just going to talk you through a little bit of the anatomy. Studies have shown that just walking through the anatomy with somebody can reduce the pain. And part of what this is giving the brain a safe image of that area of the body. So we're calming the brain's reaction to that area by just benignly talking through the anatomy. So this muscle here, the one in red, is the trapezius muscle. This upper trapezius here, that's the part that we usually clench up like this, right? That's one of those power muscles. That's our preparatory muscle to fight or run. So the upper trapezius, people often say, oh, I hold so much tension up here in my neck, right? So that's the upper trapezius that's giving you that tension. The muscles on the other side, this is on the opposite side here, they've taken the the trapezius muscle off entirely, excuse me. And we would call these ones here as a group the paraspinals. So you can see how they kind of run sort of parallel to the spine. This splenius capitis here is a little more at a diagonal. But what I want you to do is just get that image of these muscles these muscles are the ones that are typically overfiring. They're doing too much work. The nervous system is typically making these hypertonic, and that hypertonicity can become chronic, and that can be part of what's giving you the pain. So the first step here that I want you to do for a visualization is just release these muscles. So you can do this either sitting or lying down. If you'd prefer to lie down on your back with your knees bent and your feet on the floor or on the bed. And what I want you to do is keep this image of these muscles and just start with kind of putting a sensation of like a relaxation. Allow the muscles to release. So sometimes when I do this with people, they'll say, it doesn't want to release. It's like my body won't let it go. And that is part of that kind of chronic fight or flight state that your nervous system has been in for such a long time around that area if you've had chronic pain. It's almost as though the brain is holding on to that for safety. So again, having the vagus nerve stimulation on and shifting your body into that parasympathetic state will help you release this muscle, help your ability to release the muscle. And again, I find that time and again with people. So just spend a few moments here. You can keep your eyes on the image if you'd prefer, or you can go ahead and just close your eyes and just get this sensation of releasing the muscles. The other option is to trace in your mind along the edge of the muscles. Again, bringing your brain's awareness to that area in a benign way, in a calm, peaceful way. Some of my patients also like to put an image there, especially in the area where there's pain. Sometimes I've heard waves crashing on a shore or a tree blowing in the wind, whatever feels like a calming image for you. Now, when you feel like you've released those muscles, and if you need more time, please feel free to pause the video. When you feel ready, the next thing that we're going to do is take a look at that multifidi muscle. So this image is from getback.com. This is just on my computer, so I'm hoping this is going to be really well seen here. So this is your multifidi muscle. So the multifidi muscle, as I mentioned, this is your main stabilizing muscle in your spine. So what I want you to do with this is draw a green figure 8 through those muscles. I think of it like green grounding energy. So again, we're bringing the brain's attention to these muscles in a way that feels safe to the brain and in a way that provides some energy to that area, some awareness of those muscles, because often these have been inhibited and weak for a long time. So if you'd like, again, you can close your eyes, or if you prefer, just keep your eyes open and look at the image of the muscles. And see if you can, again, draw this kind of a green figure 8, like a flowing of water energy going through those muscles. See how that feels. And again, if you need more time, feel free to pause the video. Now that we've begun to change the patterning of muscle activation, we can begin doing a little bit of strengthening, just starting to wake up that multifidi muscle. So the multifidi muscle in your cervical spine is activated when you lengthen your spine. So actually by pressing your tongue to the roof of your mouth, you can activate the cervical multifidi. So the way I usually instruct people is put your tongue in its resting position, which is essentially just behind the front teeth and touching the roof of the mouth. And then just with your whole tongue, apply pressure to the roof of your mouth. Can't really see that I'm doing much. You might see my throat move a little bit, but just going to press your tongue to the roof of your mouth. And start with 10 times. Good. Now, if that feels okay, pain-free, then let's move on to the next step. If you have pain with that, what I'd like you to do is go back to the beginning of the video and continue with the visualizations and do the tongue presses in the number of repetitions that you can do without bringing on pain, and then progress yourself to the next step. So the next step is, now I want you to apply pressure with your tongue, but not with your maximum force. Cut that force about in half, and then see if you can hold that. That pressure is about what we would like in terms of how firmly the multifidi would be contracting with movement of our upper extremity. So an exercise to add on to that, just to start out, would be hold your tongue to the roof of your mouth at that 50%, about half of your maximum intensity, and then just start by lifting your arms one at a time. Got my good posture, my feet are flat on the floor. And again, if you want to do this laying down on your back with your knees bent, feet on the floor, that's completely fine. So the goal would be to get to 10 times each arm, maintaining that pressure with your tongue at that half of your maximum intensity. The way that I do this with people is I want you to be very aware of your how your body's feeling, what signals your body's giving you. So if you can get all the way through these arm lifts and maybe you get to rep 5 and you had no pain up until rep 5, or you had a low level of pain and then the pain got more intense at rep 5, what that's telling me is that your multifidi are probably fatigued at that point. And so I would rather you pause, take a break. You can go back to the visualizations again, or maybe that's enough for today and you can come back to it tomorrow. I find, particularly with my patients with chronic pain, that if we listen to the cues your body's giving you about when the multifidi have fatigued and stop at that point, that people get more strong, they get stronger much more quickly rather than trying to push through. What we're trying to do here is change the pattern of muscle activation. So most likely what's happening is your body's using other muscles to try to stabilize in your spine rather than relying on that multifidi. So you could power through and do 10 times each arm, but if you're pushing through past your pain threshold, you're probably pushing past what your multifidi have the strength and endurance for. So at that point, your body's just going to switch back and use that old pattern. So progress your way through, adding more reps as you get stronger, and soon you'll find that you'll be able to do more and more without having any pain, and you'll get to those 10 on each side, and then we can move on to more challenging exercises. So I just wanted to give a little introduction today. This is about where I'm at in terms of what my neck is feeling like. It's slowly getting better, but this is a good place to start. So please let me know if you like this video and if you'd like more like this, and subscribe and comment, like, all the things. Thank you so much for watching, and we'll see you on the next one. Take care.